I'm Dr. Ron Gardner. I'm an orthopedic surgeon in Fort Myers, Florida, where I've been in practice since the summer of 1990. One thing we've always emphasized in our practice is that surgery is not always the first solution and probably shouldn't be for most people. One of the things we found along the way is that most people will heal themselves if given an opportunity. One of the things that we've been very fortunate to be exposed to is MLS laser. And however it works, it works. And we find that we can decrease inflammation for people, decrease pain, restore function, when it seems like nothing else works frequently. So we've been very happy about that. Now we use many things in our practice, many different types of modalities, including physical therapy, prolotherapy, viscose supplementation for knee arthritis, prolozone, and of course surgery for people who have failed those things or really nothing else is appropriate. But we have been very proud of our incorporation of MLS laser in our practice. About 5 years ago, I first began hearing about laser therapy for pain relief. And I have to tell you, like most other practitioners, particularly surgeons, because we're skeptics, I thought, yeah, that's probably witchcraft, or it just doesn't work, or placebo effect. And then one after another, I had both patients and colleagues continue to tell me that this stuff worked. Well, about 2 years ago, a former associate of mine came to me and said, you have to investigate this. I have lots of friends who do this, and they aren't nuts, and they aren't charlatans, and it works in their patients, particularly in those patients who nothing else has really worked. So one thing led to another, and we became familiar with our local rep who offered to leave one in our office for a week. Now the truth is, we had no idea what we're doing, and of course a one-week protocol is not appropriate, but we had it and we used it. Now we set it up for failure. We had 19 patients who nothing else had worked. We brought them in, treated them by the book protocol, clearly inadequate, and half of them got better. So we went from the ultimate of skeptics to amazed with the results. Since then, we've actually incorporated one of these into our practice. We've been very happy with the results, and I have to say, sometimes even surprised and shocked. That doesn't work for everything. Nothing does. But it works for some people that nothing else has helped, and it's a great adjunct to our practice. We found the greatest utility in our practice for MLS laser are those things that either patients don't want to have treated with injections or surgery, or that we just really haven't been successful at treating any other way. Let me give you a few examples. Sacroiliitis, tough to treat through traditional measures. Trochanteric bursitis. People sometimes are very needle sensitive, and so a few of the things that we would normally do would be injection therapies, and people just don't want to have injections stuck in their hips. But this works, it's painless, and it works. Pezan's rhinus bursitis, plantar fasciitis, tennis elbow, all those things that hurt so bad to have injected can now be treated painlessly with MLS laser. And I think the rate of resolution of the discomfort is fairly similar for all those therapeutic entities. Like every other practice, we have a number of patients who really don't want to take medications. And let's face it, they're not really safe. Anti-inflammatories, long-term use, we know leads to some renal problems and ulcerative disease and easy bruisability and lots of things that are really undesirable. So we'd like to shy away from anti-inflammatories as well. That's to say nothing of the opioid epidemic, and the problem we have, of course, nationwide. And while we've been very fortunate about not getting people hooked on pain medications, we know what happens, and sometimes it happens faster and at lower doses than we think. This is a great alternative for those people, non-medicinal, low risk, zero risk effectively as far as I can tell, and it's a painless way to treat them. Certainly not addictive, because when the pain goes away and stays gone, there's nothing else to do for them. So we've been very happy with that regard as well. You know, we have a lot of patients come to see us for second opinions after they've had some procedure done elsewhere or after another procedure has been recommended elsewhere, who are really looking for alternatives, because we have one of the largest non-operative programs to treat osteoarthritis in this part of the state. As we've added MLS laser to that, we have opened the door to even a larger group of people who are seeking non-injection therapy, who've been through physical therapy and failed other things, but still are just not ready for surgery. So patients have really thought this was a godsend for them, particularly, of course, when it's worked nicely and when nothing else has on occasion. We've even had a few patients that came to us from their friends. Now, we don't advertise this because, let's face it, I'm an orthopedic surgeon. We get patients in here who have arthritic joints, And ultimately our goal is to get them comfortable and keep them comfortable as long as we can. But down the line, we're looking at doing joint replacements on these people. But when they suddenly become painless, they tell their friends about what we did for them. One of the things, of course, they tell about is MLS laser. Why? We're one of the very few offices in this part of the state that even has the laser. And I think that we're probably using it as much or more than anybody else because it works. While we do not actively market this as a therapeutic modality, it markets itself. And patients do come to us for it. Patients who have had it done before come to us with a different body part. And so slowly, our use of the MLS laser and its part of our market share is growing all the time. You know, while no one likes to admit it, we all have therapeutic failures. And for those patients that we tried to treat and have just been dismally unsuccessful at getting them to get pain relief, it's been a delightful addition to our practice to be able to use MLS laser for those patients. It's surprising to me how often people have failed other therapeutic modalities, but they have been successfully treated with the MLS laser. Besides that, it's kind of nice that we have something that the doctor doesn't have to do. It's done by a member of our team, and not only is it very successful for the patients, and the patients become comfortable with the therapeutic team that's administering the therapies, but it's also, of course, economically a very viable entity to our practice. It adds a stream of income that we never had before, and in a very patient-satisfying fashion. We are, as everyone knows, in an environment of economic scarcity for healthcare resources. It's getting harder and harder for us to get pre-authorization for some therapeutic modalities that we desire. This is not covered by any insurance, but that has not turned out to be the obstruction that we thought it would be. Many patients come to us knowing it's not covered and willing to pay cash for these procedures. So it's a cash-based system, which is nice for us because we don't have to use our staff for pre-authorization and then turning in billing and collections and appeals and all those things. Patients know frequently they get what they're paid for. And if they're paying for something that works for them, they're happy to do that. It's only those times that they're paying for things that don't work, of course, that they become dissatisfied. But that has not been a big problem for us for this modality. At a recent conference, I had an opportunity to talk to some other orthopedic surgeons about MLS laser. It's an easy conversation for me because if the guys have been in practice for a while, they know that they have tennis elbows that they can't help. And they know that they have quadriceps tendonitis and tendinosis and trochanteric bursitis and all the other disease entities that they can't treat, including low back pain and piriformis syndrome and sacroiliitis. Now those are frustrating to fill up your office with people you can't treat. Or if you have treated them, they weren't successful. Nobody likes to have somebody leave their practice undiagnosed or untreated, and certainly not better. This is just another avenue for them that's not only an income stream, but it really leads to higher patient satisfaction. I think for an orthopedic surgeon to not have this in their practice has really tied their hands. And I would tell any orthopedic surgeon, if he has a lot of volume in his practice, that he ought to add this as an adjunct to the rest of his practice armamentarium. There have been very few clinical entities in which I've engaged that have been as professional as cutting edge. From the salesman who first came to visit us, Byron, to the guys that I met at the American Academy of Orthopedic Surgery at the very beginning, every member of their team has been very high class, very responsive, appropriate, no pressure sales, and every time we had a question, they answered them readily. So I think you can tell that I have been impressed and very pleased with the overall presentation and the overall interactions that we've had with Cutting Edge. Our lasers were delivered. We tried to figure out how we thought it should be used, and frankly, our success rate was in the 30 to 50% range. Now again, this is on people who nothing else helped, and so we had to be happy with that. Luckily, we had an opportunity to attend the 2-day advanced learning program. I think they call it the Medical Success Program. And that really taught us how to use, market, select patients for the laser, and really taught us all the things that we need to know now. We have at least an 80% success rate at getting noticeable improvements, and probably a 60 to 70% rate of getting people greater than 80% improvement with using our MLS laser now, using their protocols and our patient selection. It was an invaluable addition to the use of MLS laser in our practice. We have seen some surprising successes, including a single treatment success in my own practice manager who was having some neck and shoulder issues, was treated one time and was remarkably better on the spot. It's kind of nice when it's your practice manager that gets that kind of result because, well, that kind of sold her on the use of the laser in general. We also have a local nurse who runs one of the diocese nursing pavilions who we tried everything on. When I say everything, I mean we tried visco supplementation, steroid injections, physical therapy, bracing, knee sleeves, platelet-rich plasma therapy, autologous adipose-derived stem cell therapy, bone marrow-derived stem cell therapies, prolotherapy, prolozone. You get the picture? I mean, nothing worked for her. So I was reluctant to try anything else, but we did MLS laser on her less than 2 months ago. And within 3 or 4 treatments, she was remarkably better. By the time she just finished the program a week or 2 ago, she is completely painless. So if that's not a success story, nothing is. Now we have one other guy who, due to having, I'm going to call it a variant of multiple sclerosis, has some musculo-tendon dyssynergy issues and has tendinitis, tendinosis, and bursitis problems. He was also not successful at almost anything we did and was tired of having things injected into him. We started him on MLS laser, and he has remarkable progress after just a few treatments. He's in the middle of treatment now, but he's already coming in here every day full of smiles.